local county officials in response to the increased number of positive COVID-19 cases and other conditions on the ground in their areas. These stay-at-home orders require that residents not venture out unless they are engaged in activities that are essential to the health and safety of themselves, their family members, or friends. These essential activities include, but are not limited to, seeking medical attention, purchasing food, and filling up gas tanks. On the Kansas side of the state line, stay-at-home orders have now been issued for Johnson, Wyandotte, Leavenworth, Douglas, Atchison, Donovan, Miami, and Lyon counties. While none of us wanted to see these orders go into effect, they are necessary to slow the spread of the coronavirus within these communities. I support our local officials as they make these difficult decisions and work to respond to the needs of their communities. My office is working with each of the counties and providing assistance from the state. To that end, tomorrow morning, I will rescind and replace Executive Order 2004, which limits mass gatherings to 50 persons. In its place, I will issue a new executive order that will limit mass gatherings to 10 persons, and also include a new framework for local communities that determine countywide stay-at-home orders are the appropriate course of action to provide for consistency and valid data collection. All counties will be required to follow this framework if and when they decide to issue a stay-at-home order. At a state level, currently 89 of Kansas's 105 counties do not have a confirmed positive case at this time, which is why we have determined that a statewide stay-at-home order is not yet a necessary course of action. However, as Dr. Norman will discuss in a few moments, confirmed positive cases are expected to tick upward at a rapid pace over the next 10 days. The crisis continues to evolve by the hour, and a statewide stay-at-home order may indeed become unavoidable in the coming days. For now, the actions we are taking today will ensure as much consistency as possible as local communities make their decisions around these increased protections for their residents. All of these actions, while disruptive and unpleasant, are absolutely necessary to keep Kansans safe and healthy and to prevent overwhelming our emergency rooms and our larger healthcare system. We've all got to do our part and work together to protect our families and our communities. We learn more about this virus every single day, and we are starting to see serious cases in every age group, not just among our seniors. The most effective way we can slow down the spread is to stay home and practice good hygiene techniques. So please continue to wash your hands, cover your mouths if you're coughing or sneezing, and take all of these orders seriously. If we all do our part now, we can get this under control much more quickly, which will lead to more lives saved. And with that, I'll turn it over to Secretary Norman.
Thank you, Governor. Let me give you a few numbers to start with. We do have 82 positive cases in the state of Kansas as of today at 10 o'clock in the morning. An encouraging number from how we are following this and how we are diagnosing is that the private labs have accounted for 47 and the Kansas Health and Environment Lab is 35. And the reason I point that out is that we have not had enough testing materials to do everything that we need to do in the state of Kansas, and the commercial labs in the state of Kansas have stepped up and are really increasing the amount of throughput, which helps us a lot. There have been 2 deaths in the state of Kansas. The governor made mention of the projections. Without getting into all the epidemiology and statistics, I will say that once you hit a number of 50, and then it becomes a little bit more reliable in terms of projecting the number of cases. The encouraging news for the state of Kansas is that we're not seeing the doubling of cases like have been seen in other states. The other states are mostly at about every 3 to 4 days, doubling the number of cases. And we're not seeing that. We're seeing about 10 or 12 cases a day. And when I give that number of 82, that includes every case to date. There are a lot of people on the one end that have recovered and are home and leading their normal lives. So the projections we have would be such that we might be looking at a total of about 300 to 400 cases by the end of this month, so about a week to 10 days from now. And that's a fairly sharp uptick, and that's from an epidemiologic perspective is what we would suggest. And I've made this analogy because the Nike swoosh, we've been down at the bottom of the Nike swoosh and just starting to creep up, and we're on the steeper part of that curve. And our job, and it really is what Governor Kelly talked about, is to level that off through the absolute adherence to the things that we know to be true. And that is the public health practices that Governor Kelly pointed out. I honestly believe that the stay at home and the defend in place and whatnot would not be necessary if we were doing all these things. So I would beseech you to really pay attention to the healthful activities that have been pointed out to you that you should be doing. The Surgeon General today was quoted, and you maybe saw that, of this is going to be, we're going into a difficult time. And it, again, goes back to that epidemiologic curve, the Nike swoosh that I mentioned. We are going to do a little bit different testing strategy at the Kansas Health and Environment Lab. With the commercial labs coming on board, we have less pressure to necessarily do everybody throughout the state, and that's really helps to decompress the limited number of kits and things we have coming in. So the state lab testing criteria are going to change just a bit in that the healthcare workers and our first responders are going to, who have been exposed or have COVID-19 symptoms.
Turn this up just a little bit. Is there a volume?
The volume's back there on the malt box, and we have been advised to not turn it up because it gets too hot.
Okay, all right.
But these are the experts.
He was asking it's on.
Last time they complained the mic was too hot,
Okay.
so they put yellow tape over that so people wouldn't screw with it. But
Can you guys hear me okay? Apparently the mic got too hot last time, so
this is why I warned you not to use me as a test voice.
I will, I'll try to speak up.
I went down, it says, the thing here, calls went down,
3.5 to 4.
yeah, 3.5%, 4%, for a week.
Okay, you good? You got what you need now? And we both have our dignity.
We have no. PD's not spending money on frivolous stuff.
Yeah, hey, this is Dwayne.
Oh, okay.
Well,
You got the audio level good? Check 1 2 1 2 1 2 1 2 1 2.
Jim made me take it back.
Okay.
Were you like, no, let's keep it.
That was a little overkill for a phone camera, but it's better than box. Okay, you guys got what you need?
Very true.
That's not my part. I'll see what they got.
You should be able to have that sound just for a second.
You should be able to pick up. Come over here. Testing, 1 2 3, testing, testing. Pause.
You guys just want to write it down? I was going to go through it. I'll do an introduction and I'll give you the names, but if you guys want the names, I'll give them to you now.
Everybody help is, Facebook Live, we're gonna do some Facebook Live, so if you're able to, it'd be great.
If you guys are ready, I'm Captain Dave Jackson.
Hey, Captain Jackson, do you guys have an ESL person here by any chance?
Yes.
Or not ESL, but I mean.
ASL, yep, got it. Yes. Do you want
Are they gonna be out as well?
to be right out here? Uh-huh.
Okay, all right, I just need to make sure I
Oh.
got it framed up.
You want to,
Yeah, we're locked.
We're fine, you don't have to do it, as long as I know they're gonna be there.
So it'll be Dave Jackson, that'll be me. Where, are you gonna stand there? That's fine.
Is that okay? Or would you?
Wherever they can get, it doesn't matter to me one way or another.
Because of right there, you would probably be better over on this side.
Whatever you guys want.
I just want to make sure that we're not leaving out.
The first speaker will, and I'll go over this in a minute, but the first speaker will be the Emergency Management Director, Jim Conley, Connelly. The next Jim, Jim Conley, Connelly. Correct. City of Kansas City, Missouri. Then it'll be the Kansas City Fire Chief, Donna Mays, Maize.
I don't think so.
What's the reason behind that?
Well, I can let you know that there probably some self-regulation going on within our daycare settings. I think a lot of parents chose to, when they were ordered to stay at home, or like our state employees being on the 2-week administrative leave, I think a lot of them actually took their kids out of daycare settings, so that's actually reduced the population there. But there are folks who are essential workers. We needed to make sure we had some place that our healthcare providers could put their kids safely during the day. We need them to be coming into our hospital. So we thought we would go ahead and let them stay open, knowing full well that the best interest of the kids is foremost in their minds.
Which counties now have confirmed community transmission apart from Johnson County?
I'll let Dr. Norman take that one.
Okay. Only Johnson County at this point. You're kind of asking what is the trigger, and there's not an absolute number that the CDC or anybody else defines. And at this point, the declaration has only been for Johnson County.
Dr. Norman, you talked on Friday about the state running out of test kits. Has that happened? And if not, what happened in the intervening day?
We have not run out of test kits. We got another shipment in over the weekend. We rely heavily on the CDC and their distribution channels. We had 500 that came in on Saturday, and then we put out a request to the colleges and universities that have research labs that have been largely decommissioned because of this infectious emergency, because some of the same kits they use as part of research are ones that we can use for COVID-19 testing, and they provided another 200 kits. So between the a little bit slower burn rate in our own labs because of the commercial labs coming on, and because of the shipment we got through the weekend, we're pretty stable this week.
So they'll last through the week or a little longer?
Depends on how many tests come in the door. We had as few as 75 on Saturday, which is a very low number for us.
Do we know where we are on unemployment filings?
I think the last number I heard is the same one you did, which was we were up 11,000. I have no doubt though that number is greater now.
What efforts are being done so far for like makeshift hospital stays? Are we at that point where we're looking into hotels possibly or anything?
Yes. That was a yes and no question, but I'll go a little deeper than that. As a matter of fact, I'm meeting this evening in Kansas City with a group we're putting together that is matching up. I described to you what the kind of epidemiologic data is and the forecast for how many cases we're going to be seeing. If you overlay with that, how many beds do we have? How many CCUs? How many ventilators? And how many different locations? We are looking to doing alternative, we call it alternative care sites. That would be something a little different than what we would normally use. The VA hospitals could serve as that. Ambulatory surgery centers could be that. We've met with military personnel and others to look at the panoply of alternative care arrangements. And this is on the very fast track. We hope to, by middle to the end of the week, to have the kind of the master plan as to when we hit certain trigger points, where will we need to have people housed. We've already backed down in hospitals throughout the metro regions of the state, so that elective surgical cases, for example, are not being done. So there's already freed up beds throughout the state. And that grid that we're putting together will be a lot farther down the road by the middle of the end of this week. We're not there to this point now, fortunately.
Would university boards be on that contingency list?
Not, well, I mean, it could be, but we're not near that point yet. I mean, other states are, the Corps of Engineers, and who we've talked to, by the way, what would it take to reconfigure a dorm room, a hotel, into being a care site? We would much prefer, if that is necessary, to use existing hospitals or healthcare facilities, because they've got gases and things are already set up, for example, at the bedside.
One more question? What do those stay-at-home guidelines look like for across the state? How will that framework work?
Yeah, you know what, and I amplify what Governor Kelly said. There's rules, and then there's application of principles. And the principle, and I keep trying to help people to understand that the principles are: how close are you to somebody for how long of a period of time? What are surfaces like? How do you clean things? When you go out, do you cross paths with somebody in a grocery store aisle? That's not a problem. So the principles are the same ones that we've been saying since the very beginning, which are 10 minutes and 6 feet, and cleaning the surfaces in between times, coughing, and those kind of things. You've heard them many times. And I really want to emphasize that if people took those things to heart, I think the more severe admonishments and rules would not necessarily be the case. And to the degree that we can really start taking those to heart, we're serious about it now.
Has anyone violated those closure rules? Are there bars open places, and does something bad happen to folks if you leave your bar open, or?
I don't comment on bars. I'll leave that to the governor.
And what would I know? We have no reports.
Pretty good.
Yeah.
Good far along.
I think Kansans are by and large complying, using their typical common sense to approach this thing. I've watched a number of small businesses, restaurants in particular, who have really figured out an alternative delivery system so that they can keep their businesses running and keep Kansans fed.
Thank you.
Do you have a list of those counties